teacher now, by profession.
Okay. Can you hear me now? Chatting for me, see. The bad thing is, I will come and meet you because this is loud enough. Hallelujah.
Amen.
All right. Today we are actually going to continue. And we are also going to conclude. So if you have not been taking notes from our previous sections, I want to advise that you take notes today. But you know, I want to say something. Not all our discussions may be for you personally. But there will be someone you will know, or there will be a time that you will actually need this wisdom. So don't be like some persons that will say that
that will say what we are about to discuss today is not of any benefit to me.
One thing about a wise man is that he is always learning. What did I say?
He's always learning.
He's always learning. So tell your neighbor and say, neighbor. Say, neighbor. Learn something new today.
Learn something new today.
Hallelujah.
Hallelujah.
Okay. The topic today again is we're talking about expectant parents. Expectant parents. I know most of us already know what we mean by expectant parents. Some of us are used to hearing the expectant mothers. It's not only the woman who is expecting. The woman can't make herself pregnant. So we are talking about expectant couples. The man expects, at the same time the woman is also expecting. So you are welcome to today's panel.
I thought you were going to clap your hands.
All right. So we have two experts that will be expounding on this topic for us. So you are getting the expert dimension today.
So
please, with a DCM welcome. No, with a DCM welcome. I want us to welcome our brother, who is a medical doctor, all the way from Youth Fellowship.
Youth Fellowship.
Dr. Tolu Adebeshi.
Dr. Tolu Adebeshi.
I should this year welcome me.
I don't know.
And our second person, which is not alien to us, is our mommy. So I want you to, which welcome are we going to give her now? Okay. Giving her also a special DCM welcome. Let us welcome Mommy BC Coca.
Mommy BC Coca.
My co-anchor for today is our dear sister Tolu Noibi. Please give her a welcome also.
Then I believe we have to welcome you to Brother Dayo.
Welcome our brother Dayo.
Once again, welcome to church. Don't forget our topic is expectant parents, spiritual and medical consideration. So to kickstart this section, I want the media team to help us project Exodus 23, verse 26. Exodus 23, verse 26.
Yeah, you're right.
I want them to project it. Sorry, I also want them to project it. I want all of us to read it together. Media, please, can you help us? All right. Ṣé gbogbo la ń rí screen yẹn? Ó yẹ jẹ́ ká jọ kà á lẹ́ẹ̀kan.
There shall nothing cast their young or be barren in thy land.
Ó jẹ́ ká ka second line yẹn nìkan. That second line says that there shall not be any barren where?
In our
Ẹ
land.
jọ̀ọ́, ta ló ń sọ̀rọ̀ yẹn? Mi ò gbọ́ dáadáa, ta ló ń sọ̀rọ̀ yẹn? So kí ni Ọlọ́run sọ?
There shall not be any barren in
Ọlọ́run ní
our
kò ní
land.
sí àgàn ní kí ni? Ṣọ́lọ́run máa ń parọ́ ni.
No.
But ṣe mọ̀ pé there are still so many people that are barren. Ṣàmọ̀ṣá. So ṣá máa sọ pé Ọlọ́run ń parọ́ ni. Okay. So we want to throw this question to our brother, Dr. Tolu. What can you say about expectant parents?
Okay. Good morning, church. My name is Tolu Adebeshi. And thank you. I want to thank the leadership of the church for this opportunity and the entire congregation.
You have to speak louder.
Okay. An expectant parent. That is a way of communicating it in a layman language. There is a way we call it medically. But in medicine, when you say a couple is expectant, it basically means that the couple has been having regular, constant, unprotected sexual intercourse for a period of 1 year, and there is no conception. So there is difficulty conceiving despite regular, unprotected sexual intercourse without any form of contraception.
The age factor?
Okay. So the definition I've given has some factors to be considered. For instance, a woman that is less than, that definition that I've given is applicable to a woman that is less than 35 years. Once a woman is 35 and above, the definition changed from regular unprotected sexual intercourse of 1 year to 6 months. Meaning that as a woman advances in age, our fecundity decreases. That's our chances of getting pregnant reduces. So the parameter is no longer 12 months. Once a woman is more than 35, then it's reduced to 6 months. Basically, if a woman doesn't conceive after regular sexual intercourse for a period of 6 months and she's above 35, there is need to look for why. For the couple to look for why. Because it's never an individual problem. It's a couple thing. And most often than not, because, the women are at the forefront, they get more concerned. And because of pressure from here and there, they are usually the first to go out to look for why there is delay. And statistics has that about 40% of time, the man is even the problem. But everybody focus more on the woman.
Sorry, nǹkan tí wọ́n sọ ni wípé wíwojú Olúwa fún ọmọ àbí dáwọ́ dúró lórí àti bímọ pé ọ̀rọ̀ ọkùnrin àti obìnrin ni. Ó dẹ̀ ní wípé ká tó sọ pé bóyá ẹni ń wá ọmọ àbí kò tí ì bímọ wípé ọkọ àti ìyàwó yẹn láti máa gbé papọ̀. Wọ́n láti máa bára wọn lò pọ̀ láì fi ètò sọmọ bíbí kankan, at least ó kéré jù fún ọdún kan ní gbogbo ìgbà tí wọ́n máa bára wọn lò pọ̀ ní gbogbo ìgbà, bó ṣojoojúmọ́ ni, bó ṣọ ìṣẹ́jú ni, bó ṣe wákàtí ni bó bá ṣe rọrùn fún ọdún kan mo mọ̀ pé máa sọ̀rọ̀ sí yẹn bó bá ṣe rọrùn fún ọdún kan tí ẹni yẹn ò bá wá tí ì lóyún ìyẹn la máa sọ wípé òkè o ó yẹ ká wá nǹkan tó jẹ́ pé kí ló dé tí oyún ò tí ì dé wọ́n dẹ̀ ní pé ọ̀rọ̀ tá à ń sọ yìí kì í ṣe ti mọ́mì wa nìkan kì í ṣọ̀rọ̀ obìnrin tọkùnrin bá gbé bẹ́ẹ̀ lóbìnrin ń pọ̀ ta pé so ọkùnrin náà wọ́n nínú ìdá mẹ́wàá wípé ọkùnrin ní ìdá mẹ́rin obìnrin ó wá ní bí ìdá mẹ́fà wọ́n ní ọjọ́ orí obìnrin tún wá ṣe kókó àti pàtàkì wípé obìnrin tó bá ti jẹ́ pé ó pé 35 kó tó lọ́kọ àbí ó pé 35 kó tó rẹ́ni tó fẹ́ bímọ wípé ó ti wá kúrò nínú pé kó máa ní ìbálòpọ̀ lóòrèkóòrè fún ọdún kan ó ti wá gé kúrú sí oṣù mẹ́fà wípé so obìnrin tó bá ń wojú olúwa tó bá ti pé 35 bá ẹ̀ṣẹ̀ máa rì tó bá ti wá ń wojú olúwa lẹ́yìn ọdún méjì wípé ó yẹ kó ti bẹ̀rẹ̀ sí ní ṣe nǹkan kan láti wò pé kí ló ń ṣẹlẹ̀ láti ìgbà tó ti pé oṣù mẹ́fà tí ò rí ṣé nǹkan tí mò ń sọ yé wa thank you.
So Mommy Coca is already acting as our interpreter. Also,
okay, we need to understand that when you are expecting, it's actually a very serious situation. Giving a little example of myself, just a little example of myself. I remember the first month we got married, the test. You know all these PT strips that the line will show, but it is so faint. So my husband said, it's nothing. I said, it better be something. After 1 month, do you understand? I panicked. So and now from that point in time, I realized what it actually felt like to expect something that you can't even control. And then it seems like it's not there. Of course, eventually it was there, but since then, I had a rethink. And I respected everybody who was expecting all around me. Because if I could not wait for 1 month, then you can imagine what they are going through. You would like to add something, sir?
Yeah. Okay, what I would like to add is that ní ọ̀pọ̀lọpọ̀ ìgbà a kì í lè even olóyìnbó gan máa sọ fún wa wípé there are some things that are idiopathic. Ó túmọ̀ sí pé ẹ lè sọ pé nǹkan báyìí ló ń fà á. Ọkọ àtaya máa marry bóyá wọ́n ti ń expect ọmọ oṣù mẹ́fà ọdún kan kò ṣẹlẹ̀ wọ́n wá sí hospital. Ìgbà tẹ́ bá carry out gbogbo test lára ìyàwó everything wà okay. Lára ọkọ everything wà okay. In that situation, all we can say is for the couple to keep on trying because ó máa ṣẹlẹ̀ eventually. To the glory of God, I delivered a baby yesterday. The couple has been expectant for 5 years. And when we did the surgery, there was nothing wrong with the womb. There was nothing happening anywhere that you could pinpoint that, okay, this is why the pregnancy was delayed. But it happened. So I just want us to know that sometimes there is no known cause to why there is a delay, but eventually it will come.
Please clap for him, please. Àwa ọkùnrin ṣé a accept nǹkan tó sọ? Do we accept it? Ó yẹ sọ̀rọ̀ na yes or no? Do we accept it? Ẹ̀yin obìnrin ṣé accept nǹkan tó sọ yìí? No, say the truth. Now, do you accept it, yes or no? Okay, now this thing that doctor just said now, many of us may not be privy to it before now. So I want to throw it to Mommy Bisi Coca. Most times when there is a delay, there is, especially the waiting there, there's always this blame party. The wife may say it's the husband. The husband may say it's the wife. Both of them are not reaching an agreement. How do you think couples should handle this kind of case?
Thank you. When there is a delay, I don't think the blame game would help any situation. Unfortunately, nobody pay on wojú Olúwa fún ọmọ. Ní Nàìjíríà, ní Áfíríkà tàwa yìí, àwọn obìnrin náà rò pa àdálẹ̀. wọ́n bìlí pé orí wa ló ti bẹ̀rẹ̀, wọ́n bìlí pé àwa la lè fúnra wa lóyún, wọ́n bìlí pé àwa la wà responsible torí gbà yẹn àwa tó ju wáyé báyìí wọ́n lè lè mèrè ní wa ẹni tó bá sanra wọn ló gbogbo oúnjẹ ọ̀rá ti pọ̀ jù kò lè ráyè bímọ eléyìí tó gbẹ wọn ní ó ti gbẹ kó ti ṣẹ́ gbogbo oyún gbogbo ọmọ inú ẹ̀ tán kò sí tí wọn ò ní rí sọ ọ̀pọ̀lọpọ̀ gbà most of the times the blame is always on the women because of the time most people don't even look at àwọn míì mọ̀ jẹ́ pé wọ́n máa mọ̀ pé ọkọ ní problem wọ́n dẹ̀ tún sì máa sọ fún ìyàwó pé ìwọ ló yẹ kó wá nǹkan ṣe sí be so many mental things that we are going through now you already know that the man has a problem you are putting the blame on the woman there is no point to blame ọ̀rọ̀ yìí ọ̀rọ̀ àwa méjèèjì ni àṣẹrí ẹ má bínú o tọ́rọ̀ bá délẹ̀ tán tó bá tún bímọ tán ta ló orúkọ ta lọmọ máa ń jẹ́ náà.
The man's name.
Ṣé pé is cheating on every way it is not good to my blame ọ̀rọ̀ tó wà lẹ́yìn ọ̀rọ̀ wa ni àwa méjèèjì la máa jìjọ jókòó sọ bá a ṣe máa ṣe ó depend lórí àwa méjèèjì but obìnrin láti mọ orú ọkọ tó fẹ́ ọkọ láti mọ orú obìnrin tó fẹ́ both of us are leaning on each other for support but we need the support mostly from the men because àwọn obìnrin the society gbogbo aládùúgbò náà ti ìjọ tó ti wọlé ọkọ náà ti máa ṣe prayer níbi reception níwòye oṣù mẹ́sàn-án à ń bọ̀ wá bá yín jẹun àbí bẹ́ẹ̀ ni páwọn náà máa gbé síbẹ̀ lóṣù mẹ́sàn-án tóṣù mẹ́sàn-án bá wá dé tó máa rí ó bá ń jó ṣọ́ọ̀ṣì aṣàdúrà sí ẹ̀bù ọ̀pọ̀lọpọ̀ wa ó bá ń jó ṣọ́ọ̀ṣì wọn sí tẹ́ báyìí tó máa wọ ẹlòmíì báyìí bíi pé kọ́kọ́ wọn fẹ́ wọlé bíi pé ìjà wo ló ṣèyàwó happy anniversary ẹ ti ṣe anniversary tó máa ń kí ẹ ó nítumọ̀ gbogbo wa la mọ̀ instead of us to support many of the times because of this blame game ta máa ń ṣe and the men ẹjọ́ abẹ́yìn we need more of the support obìnrin we are moved by what we hear it's only men that are moved by what they say what they see we women we are moved just telling your wife that má worry ẹgbọ́n kan tá a kánà sọ fún Anna ó ní ṣé mi ò tó ju ọmọ mẹ́wàá fún ẹ lọ ni that support was enough for Anna ọ̀pọ̀lọpọ̀ ọkùnrin máa ń fọ́bìnrin ní support bẹ́ẹ̀ the problem will not be as much as so we don't need to try to play blame ẹ jẹ́ ká jìjọ jókòó ká jìjọ fọwọ́sowọ́pọ̀ bá a ṣe máa yanjú ẹ̀ báwo ṣe máa rọ̀.
Okay, in addition to what Mommy has just said, we should also understand that when it gets to the situation where when we get to the situation where we feel like we've been trying to have a baby and it has not come, what are we supposed to do? Instead of having this silent blame amongst ourselves or even vocal blame, I believe that rationally the first thing we should think of is to go to the hospital to seek professional advice. And when we are talking about professional advice here, we are not talking about for the woman to go like we see is in our norm, the African society. The problem might not be with the woman, like our doctor rightly said. 40% at times is usually the men. Perhaps the other 40 or 50 or 60 is the woman. Or let's put the 10% as they are even both okay. You understand? So I think that first and foremost, the couple, man and woman, should seek professional advice. That would help them get down to the solution faster than we think, instead of the blame game.
Two questions for you. The first one is just as she has said, as a doctor, what professional advice would you give or would you recommend for a couple that is expectant? That's number one. Then the second question is also for you and Mommy BC Coca, and that is, what are the things that a man or a woman may do at a young age that may affect fertility in the future?
Okay, thank you so much for that question. The first question about professional advice for on what the couples should do. I will start by saying that we need to seek professional medical attention And one factor we all need to bear in mind is that we should know where we go for help. A lot of people, I listen to all sort of promos on the road, people telling you that something cleanser, something this. People advertise so many things. I'm personally, from a professional point of view, a lot of people take a lot of herbs that are more injurious to their system than advantageous. And most of the time, some of these things that people drink, some of these concoctions, affect people more than it should help them. Let me give a practical example. I've seen a woman who has been expectant for some time, and then a PhD holder, and she went to one of these herbal company, I don't know, or maybe a herbal shop or an herbalist, I don't know who she went to meet, and they give her some leaves or something to insert into her private part. She continued doing that until the whole place almost closed up. So you have to do like a reconstructive surgery. So when there is even no part for the pregnancy to happen, how do you explain that? And it's been said in literature that one of the commonest causes of infertility, especially among men, is the use of alcohol. Alcohol is a bad chemical. It causes a lot of damage to the system. People will tell you that, but I was told that red wine is good for the heart. If it's good for the heart, is it good for the kidneys? Is it good for the liver? And God has made our body so perfect that even if there is a molecule of alcohol that your body needs for a particular function, there are machineries in place that will synthesize that. So if we can, we should do away with all those toxic things. And I know that doing that, we are living a healthy life. Every other thing will fall in place. Secondly, apart from going to the hospital to seek professional advice, another common problem is some couples don't even meet adequately. Our mommy said something the other time that we should have sexual intercourse as regular as possible. But that's the truth. Sometimes the husband is living in Abuja, the wife is in Lagos. You get to meet maybe once or twice a month, and you expect that pregnancy will happen. It's not everybody that is lucky that immediately you meet with a woman, pregnancy comes. Sometimes you have to go the extra mile, and the recommended time to meet, you should have sexual intercourse about 4 to 6 times a week.
Yes, now, even more.
Yes. Because there are two reasons why couples have sexual intercourse. Number one, you can do it for the fun of it, to enjoy your marriage.
Is it that we don't agree or we over-agree?
Or it's too much. Or it's not enough.
It's too much.
It's not too much. I like it,
okay,
sir.
What if the man is doing morning and night shift and is very tired? How do you expect him to?
Where there are some responsibility that cannot be carried over. You just need to find time to do them. But let me continue what I was saying, sir. So you have to make the intercourse regular. And the reason for 4 to 6 times a week is because if you consider the fact that not everybody that wants that is so lucky that immediately you meet with a woman, the woman gets pregnant. Sometimes you have to do extra work, and that extra work is increasing the number of meeting time. And let me tell us why. The egg of a woman, every month a woman releases 1 egg. And that egg is what gets matured to become menses. If that egg is lucky to be fertilized by a sperm, it becomes a baby. Now, that egg can last up to 72 hours before turning to blood. The sperm of a man, that egg can last up to 6 days, I mean to say. The sperm of a man can last up to 72 hours. So if you have a sexual intercourse today,
and there is a volume of sperm that has been deposited. All of them are running. The distance is very long. They are moving from the vagina of the woman all the way to the fallopian tube of the woman. So it's a long distance, and that is why each and every one of us is a special being. We won the race during our time. So there is a lot of sperm trying to achieve that. And for a man to fertilize a woman, scientifically, it's been said that minimum of 20 million sperm. But out of the 20 million, is only one that is going to fertilize the egg. So if you deposit some today, and you meet again maybe in another 48 hours or 72 hours, you deposit another, you are increasing the chances of fertilizing that woman. But if you do one today, and then you off-light another 1 month before another, it's almost impossible, except through the grace of God, to fertilize that woman. So we really need to be mindful of that. Now, what are the things that people do at young age that can affect fertility? Number one, I would like to talk about this. There is something that is very common among children, especially when it affects male. We shouldn't take it with levity. We call it mumps. Yoruba man peni shegede. It's a form of that the jaw will be swollen. It's a form of viral infection that can affect the testes. And if you don't take proper care of it as a child, in that child, there will be no problem. Eventually, the virus will go away, but it has caused a damage to those testicles. And by the time the child is of age to start, to become a father, there will be problem. And nobody will remember that there was ever a viral infection at some point. So when we see anything in them, don't let us keep them at home. That, I will just give you paracetamol. Let's take them to the hospital. Another thing is that we do a lot of things that, like some people, the testicle of a man needs an adequate amount of temperature for normal sperm formation. And that is why those testicles are outside. As a man, if you observe, when you wake up in the morning, the testicles, the scrotum will shrink. It comes closer to the body to get some warmth, because that's the best temperature at that time. And as the day progresses, that the sun comes, the temperature of the surrounding is high, then it lacks. So for the testicle to dissipate some heat. But some men will wear a nylon pant, boxers, first short, second short, khaki, and then they will now wear cardigan. All those heat are causing more damage than good to those testicles. And it will be very difficult to bring anything good out of that. For the women, sometimes I will go back to our health-seeking behavior. At some point, there is this common saying in obstetrics that every pregnancy is at risk of being miscarried. So let's assume somebody had a miscarriage and you feel like, everything is out. You don't get to go to the hospital because you are not bleeding. Some materials can be left in there and it can get infected. And there will be no problem. What will just happen is that the womb will just shut down. Everything will heal by fibrosis. It will gum together. And the person will see her menses, but it will be very difficult for fertilization to happen. Another thing is, some people do some form of unnecessary practices. The private part of a woman is not meant to be clean.
Down.
Please don't misquote me. I'm not saying the outside. The inside, some people will insert soap to clean. What you are doing is you are killing the normal flora of the vagina. Imagine if you are not at home, you leave your door open. Anything can come in. So once you do that, you give room for the pathologic bacteria to flow in and cause damage. And the person will tell you that, I keep having this very offensive vaginal discharge, and eventually it will lead to some form of what we call PID, pelvic inflammatory disease, and there will be no room for conception. So there are so many things that we do. The list is long, but we just need to be conscious of what we do. Thank you.
Thank you so much.
Thank you, check and owó pé mo lè interpret but mo mọ̀ pé ẹgbọ́n kan tó sọ nípa bọ́n ṣe ń bímọ yẹn.
Yes.
Gbogbo wa lóye. So what I want to say is apart from pé à ń dúró de àwọn ojú a lọ sí hospital gẹ́gẹ́ bí ọkọ àti ìyàwó ó yẹ ká tẹ́ pẹpẹ àdúrà wa sí ó yẹ ká bá Ọlọ́run sọ. When we marry ó yẹ ká jókòó ká ní plan wa ẹni tí ò bá ní plan kò nílé ayé gbé ó yẹ ká ní plan Ọlọ́run ìgbéyàwó ta fẹ́ ṣe a fẹ́ bí ọmọ o ọmọ 3 ló wù wá o ọmọ 2 ló wù wá o ràn wá lọ́wọ́ o fún wa lórí ọ̀fẹ́ o tó bá dẹ̀ ti rí pé kò tí ì wá bàbá kí ló ń ṣẹlẹ̀ pápá bo ni ká rìn sí báwo ni ká ṣe ṣe níwọ̀n tó bá lọ sí hospital jẹ́ ká bójú rere ẹ̀ pàdé níbẹ̀ gbogbo nǹkan tó bá àtúnṣe tó bá yẹ kó o ṣe kọ́lọ̀ ń fúnra rẹ̀ kó wá so we need to seek the face of God and then some of other factors àwọn nǹkan tá a rò pé ó tún lè fa ìdádúró fún ọkọ àbí aya láti bímọ mò ń wo bíbá mò ń sọ̀rọ̀ nípa drug abuse wọ́n tún jẹ́ pé láti kékeré àti ẹ̀fẹ́ kí nǹkan kan ṣe wá àti wọ́n máa ń kó oògùn jẹ ẹlòmíì tó bá ń jẹ paracetamol báyìí bíi chalk ló ṣe máa jẹ kò tiẹ̀ ní láti lomi mọ́ chloroquine nǹkan tó sọ̀rọ̀ gbogbo ìpàtẹ́ ìṣègùn ló wà lórí ẹ̀ kẹ́ tó bí pé kí ló ṣẹlẹ̀ máa rò pé bóyá ó ti kọ́ mẹ́sìn láti inú oyún ni tó bá ti sọ fún pé kíní kan ló ṣe yín lọ́lọ́ kíní yìí kíní kan ló ṣe yín kíní kan ni mo lò lánàá gbogbo ẹ̀ ló mọ̀ àmọ́ pé gbogbo oògùn tá a bá ń lò bó ṣe ní ìrọ̀rùn tó fẹ́ fún wa bẹ́ẹ̀ náà ló ní ìpalára tó lè ṣe fún ara wa so aláti wà kíáfù pẹ̀lú gbogbo àwọn nǹkan tó jẹ́ pa kàn máa ń dàjẹ́ ẹlòmíì ò ní jẹun rárá ó kàn máa á lo tàárọ̀ á lo tọ̀sán kò ní jẹun inú àwà síbẹ̀ láti ọ̀pọ̀lọpọ̀ nínú wa á ní ọ̀sà ẹlòmíì ọ̀sà tó ní kì í ṣe pé torí pé ó ń gbàwẹ̀ oògùn ló ń fà all these are things aláti ṣọ́ irú àwọn oògùn tá à ń lò tí wọ́n bá recommend oògùn fún ẹ má kó jẹ tó máa recommend oògùn fún ẹ wọ́n máa níjọ́ tó máa sọ pé lò fúnjọ́ 3 lò fúnjọ́ 4 lò fúnjọ́ 2 oògùn tó ní kó lò fúnjọ́ 2 má lò fóṣù kan má lò fọ́dún kan torí pé kó lè patán pátápátá pẹ̀lẹ́ ara ẹ ló ń pa yẹn ìwọ ló mọ̀. So another thing we need to talk about is our BP ìrònú bá ṣe jókòó ìbáyẹn lómi bọ́dì ló wà mí báyìí kò sẹ́ńjì ó ti lọ ìrònú ni ọmọ skul máa jẹun kí la máa jẹ tá bá délé òjò máa rọ̀ òjò yóò gbọ́dọ̀ rọ̀ o báwo la ṣe fẹ́ ṣe ọ̀pọ̀lọpọ̀ nǹkan là ń kó sáyà ọ̀pọ̀lọpọ̀ nǹkan tá à ń rò bẹ́ẹ̀ni sọ fún wa ó ní Ọlọ́run ó ló dá ayé àtọ̀run ó láyé yìí ó ló fi ṣàpótí ìtìsẹ̀ tọ́lọ́run bá fi ayé ṣàpótí ìtìsẹ̀ kí ló ṣèwọ tó wá ṣùṣùkà tó gbélé ayé ọ̀hún wò àbí ẹ jẹ́ ká jù sílẹ̀ gbogbo nǹkan tá à ń rò tílẹ̀ bá ẹ̀dá aláìkí ẹ̀ tó yá sí ilẹ̀ máa ṣú èní á tún lọ ọ̀la á tún dé ó fẹ́ rí Monday àkúkú wá tó bá tún yá Wednesday á tún lọ another Monday tún yọjú bọ̀ ẹ jẹ́ ká gbogbo nǹkan tá a bá ń rò nínú ọkàn wa ẹ jẹ́ ká fi fọ́ lọ́hùn because tó bá ń wojú Olúwa tó bá tún ronú ìrònú gbogbo pressure tó wà lára ẹ̀ tó bá ní BP ó máa affect tó bá lóyún ṣe àwọn pé bọ́dì tá à ń rò iná òórùn la fẹ́ fi gbé oyún tó bá ti bà bọ́dì náà jẹ́ kí la fẹ́ lò wọ́n láti rò dáadáa láti máa wò then another thing is HVS like she was talking about ilé obìnrin wípé àwa kan máa ń fọ́ wọ́n máa ń advertise kan ní gbogbo gbà obìnrin mo dẹ̀ máa ń rí bẹ̀ ní Òṣòdì ní gbogbo ẹ̀ àwọn ọmọ Ìgbò yẹn máa pariwo Staphylococcus aureus Staphylococcus aureus Staphylococcus aureus àwọn mélòó la máa ń gbọ́ gbogbo wa la máa ń gbọ́ bẹ́ẹ̀ ni pé organism yẹn ilé ayé tó wá báyìí kò yẹ kọ́ lọ́hún dá irọ́ dẹ̀ ní gbogbo ẹ̀ normally Staphylococcus aureus ó yẹ kó wà níbẹ̀ yẹn because oníṣẹ́ tó ń ṣe níbẹ̀ tó tó bá ti lọ ra kíní lọ́wọ́ ọmọ Ìgbò tẹ́tí kìbọ̀ tẹ́tí pa nítorí kó ṣe bẹ́ẹ̀ kò ní lè ṣe mọ́ and these are some of the things that causes vaginal cancer and all these cancers that we are talking about. ẹ jẹ́ ká wà very careful ṣẹ́rí nǹkan tó máa ń dùn mí ni pé àwọn tí mo rò pé ó yẹ kán kàwé tó yẹ kán gbọ́n àwọn lè máa rí díẹ̀ tó máa béèrè how much you no give me 3 for 500 naira àwọn tó yẹ kán wà knowledgeable to say what are you selling àwọn lè máa rí tomato give me one make we share the price I understand so we need to know all this check all these these are things that we know pad táwọn obìnrin máa ń lò pad wa we need to be careful ọ̀pọ̀lọpọ̀ ń gbà míì wa toilet roll la máa ń lò if you use a particular pad for a very long time it's going to start affecting you. To give you a PID, you need to have constant change. And then hygiene was very important. Ẹlòmíì menses pátá tó fi ṣe menses ó máa gan odijọ́ tó bá fẹ́ lòmíì kó tún tó fọ̀ pátá sàlẹ̀ lòmíì òórùn perfume la fi ń parí ẹ̀. Ẹ jẹ́ ká bọ́ ọ̀rọ̀ wa sọ tọrọ gbogbo àwọn hygiene wa àwọn dádì wa náà ẹlòmíì wọ boxer oṣù kan boxer oṣù kan ìwọ̀n pé wọ́n yàlẹ́ àti fọ̀ wọ́n ti bọ́ wọ́n á dùúlẹ̀ báyìí wọ́n ti bọ́ wọ́n onímọ̀ pẹ́lẹ́ táwọn dúlẹ̀ last week ó làwọn tún he wọ́n tún gbé wọ̀ wọ́n lọ tí wọ́n nìyẹn. Ẹ jẹ́ ká gbogbo hygiene báyìí ẹ jẹ́ ká we need to take care of our hygiene. It's very important. Ọlọ́run á ràn wá lọ́wọ́.
Amen. Amen. Thank you, Mommy. Our doctor in the house. Are there other things, as laymen, we have heard a lot of things that can also trigger infertility in both men and women? For example, we've heard of when a man is young and he sows his seeds everywhere, constant being sexually active, and then when it's time for him to start having babies with his wife, then we start having what do they call it? Is it low sperm count or the likes? So we would like you to dwell into those other areas. Mommy has talked about hygiene. We want to talk about habits.
Before you answer the question, please, if you have questions, the wordings are moving around. Just signify and they will take your question.
Okay, thank you so much for the question. Before I answer that question, I would like to add something to what Mommy said. So for some of us, the problem is not self-medication. It's not like we are getting drugs. There are some of the drugs that we are even being given in the hospital that can have some side effects that are not good. For instance, there are some antihypertensive that when we take them, they can affect our libido. They can affect our performance as a man. And that is why when a doctor is giving you a prescription, for every drug, there are lists of side effects. There is no single drug that doesn't have its own side effect. Even if it's just vomiting and diarrhea, there is a side effect. And the doctor will give you some instruction. Okay, the fact that this particular drug can cause a rash doesn't mean you must have the rash. I don't know if you are understanding what I'm saying. There are side effects to almost all the drugs, but it's not a must that side effect must manifest in everybody. However, if you notice anything, it's important you go back to the doctor that, doctor, after taking this medication, I had this side effect. Then there can be a change. There is no single, for common illnesses, there is no disease that has only one drug for its treatment. There is always an alternative. So if you have one side effect, we can switch to another. So it's important, even for the prescription drug. If you notice any side effect, it's important we let our doctors be aware. Then another thing, if you are taking a particular medication, it's important, some of us, we see our doctors regularly, but we do some practices like maybe somebody just tell you about a particular drug. Like a lot of people use sexual enhancement drug, things like Viagra, and you're on antihypertensive. For instance, somebody taking nitroglycerin, maybe the person has some form of chest pain, and the doctor gave you nitroglycerin at some point. But during your clinic visit, you never mentioned to the doctor that, I'm using one enhancer or something, and you combine it. The combination will make that person to drop dead instantly. Because both of them are meant to reduce your blood pressure. One is a sexual enhancer, but it functions in a similar manner to the one that is meant to relieve your pain. They just open your veins so that blood is not too much. So by the time you use one, it has already opened your vein, and you now use the sexual enhancer. Further reduction in the blood pressure, the person is gone. And it happened like instantly. So it's important. If you are taking any medication, some of us have been, we've had some form of health outreach whereby people will come and they are so bent on, it's not a must. Some people, I don't know why people love drugs so much. That even if you deliver a child and you are sending the child home, the mother will tell you that where is the drug for the baby? And I will look at the mother that tell me what is wrong with the baby. It's not a must that you must. If nothing is wrong, there is no need for drug. Some people cherish drugs so much. When you don't have anything. Except people that have chronic conditions like maybe diabetes, hypertension, those kind of drugs, they are forever. You need to take them constantly. There is no need to be chewing drug up and down. Okay, so for the other question that you asked about
habits.
Okay, habits, yes. God has blessed men so much that a man will continue to produce sperm forever. But the story is different for the female. Now, let me chip in a bit of spiritual. I'm an advocate of no sex before marriage.
He deserves a round of applause.
So, but there is something that is very common. I like to be very practical. Even in church, it's important we tell ourselves the truth. There's no need to shy from it. There is a form of practice that is common among so many people. Self-satisfaction. People do masturbation to have sexual pleasure. Those practices are not good. Let me tell you why. It might not be a problem of low sperm count, but it reduces your performance in a way, because the nerve ending on the penis get numb to the point that before you even, by the time you continue that habit, before you touch again, the sperm is already out. So when you now want to satisfy your wife, before you even climb on the woman, you are out, and they will call you a 5-second man, and you'll get angry. And it's important I also mention at this point that there are some problems that we don't talk about. As women are going through some things, men are also going through a lot of things. But you want to be a man, and something like that. There are times that, even as human, we get tired. Our sexual drive as a man will go down. Or there might even be a problem that you cannot explain. At that time, you need to speak up. You need support. That's not the time to hide under, nothing is happening. And in our environment, people they will just use anger to cut it. And stuff like that. When we have those kind of things, we need to reach out to people for support. It's important. So masturbation is one habit that is very bad. Alcoholism is another. All those things destroy our body. Then another thing is, being faithful. It's very important. As a Christian, it's our duty to be holy unto God. And some of this, because one thing about having multiple sexual partners is that you start sharing some microbes. And that's why there will be problem. Most of the time, a lot of things arise from there. Infertility, people picks up human papilloma virus, which is the cause of cervical cancer. And it also causes penile cancer and anogenital cancer in male. So all those things, people get them from sexual intercourse, having multiple sexual intercourse. And another thing is that early exposure to sex is a bad thing, except you are of age and you have everything to take responsibility, which is what? Marriage.
Okay.
Thank you so much. Let's take it a step further. They are intending couples. Are there any compatibility tests that they need to take or that they need to be aware of that can cause infertility?
Thank you. There are. One is the genotype thing. Compatibility of AA, AS. Àyẹ̀wò ẹ̀jẹ̀ náà máa lọ ṣe. Wọ́n máa fi mọ̀ bóyá ẹni jẹ́ AA àbí AS. Tó bá jẹ́ AA àti AS ni, wọ́n á ní òkè, wọ́n á fún wọn ní go ahead. But tó bá ti jẹ́ pé AS àti AS ni, káwọn méjèèjì ti múra lẹ̀ pé bọ́lọ̀ ń bá ti ń fún wọn lórí ọ̀fẹ́, hospital làwọn máa dájọ́ sí. Kò sí, because once you have, most of the time people that have AS, they really escape having an excess child. And now, I have a friend of mine, AS, I want to refer. So we need to, it's important that we know our genotype and our blood group, especially when we want to get married. Very, very important. One key thing that we need to know. Temperament, Arawa. Even so, Amos 3:3. Only can two people work together, except they agree. Oninu fufu ni e. O lo fe oko ninu fufu. Kò síjọ́ tẹ́ ní yàdá síra yín gbẹ̀yìn. Because kó tó sọ̀rọ̀ ìwọ náà ti sọ mẹ́jọ. Ó dẹ̀ sì mọ̀ pé kò lára láti lè gba mẹ́jọ tó ń sọ. So kò sígbà tẹ́ ní jíjọ parí ẹ̀. We need to look at our temperament, know who we are. Mo rú èèyàn tó jẹ́. Mo rú èèyàn tó kọ ìjẹ́. We need to know the families of people we want to marry into. Ọ̀pọ̀lọpọ̀ nu wa àti lọ máa gbélé ọkọ àmẹ́ni tó ṣu ọkọ náà. Àmọ́ ọmọ yẹn ṣe é lé wọn. Pàtó wá ti wá fẹ́ tán tó bímọ kan tó bímọ méjì tó máa dé. Wàá ṣe máa ní ẹ. Irú ilé wo tiẹ̀ nílé yín nílé wa wò kí ṣe báyìí. Ṣó òwò tẹ́lẹ̀ ni? Lọ mọ rú èèyàn tó ń jẹ́. Kò ṣe jọ wedding. Wọ́n máa ṣe àyà àwọn èèyàn wá tán máa kó wọn sẹ́yìn. Tá máa dún àwọn ẹbí ọkọ dà wá rèé. Wọ́n dẹ̀bálẹ̀ tán wọ́n á lọ tán. Gbogbo àwọn ojú tó rí ń jọ yẹn ò tún rí wọn mọ́. Another face ló wá ń wọlé wá bẹ́ẹ̀ ń sìn. We need to know the families that we have come from. We need to be truthful one to the other. Ọkọ àti àtàbárìra wa, ẹ jẹ́ ká bára wa sòótọ́ ọ̀rọ̀. Mo ṣe torí pé mo target ẹ mo dẹ̀ ti mọ̀ nǹkan tó like. Wá yẹ pé màá fi pamọ́. Mo dẹ̀ mọ̀ bí mo ṣe rí. It's important that we learn to do all that.
Okay. Mommy, I was hoping you were going to talk about the resource factor.
Okay.
You go for that, right?
Thank you so much, Ma. With the level of advancement in technology, I don't think there should be any SS child again.
Okay.
I don't care about how much love or how much you hold that person, because that thing that you call love will soon become something else when you start having children, and you have to save money for the hospital. You plan that, okay, I'm expecting crisis at least 2 or 3 times a year if you're lucky. So there shouldn't be any excess child again. Now, number 2 is, another thing that couples need to do is to check their blood group. There are some blood groups that are not compatible. Not for you. You know, as I said earlier, medicine has advanced so much that we now know so many things. In the olden days, they used to talk about Abiku. Most of those things that were referred to as Abiku are more of blood group incompatibility and genotype and things like that. So it's important we know our blood group as well. Then another thing I would like to talk about, we advise women generally to take folic acid. Folic acid prepares the womb of a woman for pregnancy. Just take it routinely. It's important. That's one of the things that people need to do before marriage. Then we also advise women to do at least a scan, or maybe to scan their womb every year for fibroid. And the reason for this is because virtually every woman has fibroid. What differentiates one from another is the size. Fibroid can be as tiny as beads, and they can be as big as 9-month pregnancy in some people. However, some fibroids, don't disturb pregnancy, conception. What matters is the location of that fibroid. If the fibroid of a woman is located at the entrance of the womb, it's almost impossible to get pregnant. If the fibroid is projecting into the space of the womb, it's almost impossible to get pregnant. But if the fibroid is the one that is grown outside of the womb, the woman can still get pregnant. A lot of people move around. They've had 4 or 5 children, but they are not even aware that they have fibroid. But another thing is that for we parents, we also need to advise our kids or our children. We should encourage early, in quote, marriage. Once a child has gone through the normal process of schooling, she's a graduate, she's working and she's doing fine. You don't need to have plenty money. Try to marry as early as possible, because marriage will help you to prevent fibroid in a way. If a woman gets pregnant, the period of being pregnant takes out estrogen. Estrogen is the hormone that feeds fibroid, that makes it grow. You see a woman, she's almost 40 and she's not married yet. Check. There must be fibroid. The longer you are exposed to just regular menses, estrogen, the higher your chances of developing fibroid. And if you have before, the higher the chances of rapid growth of that fibroid. So it's important.
Okay, we've been talking about issues of that trigger lack of conception. Mommy, I think it's time for us to go into things that might trigger miscarriages. People that have stillbirth, people that carry babies to 6 months and then it drops. Even some people, few days to delivery, the baby just stops beating or kicking. You understand? Okay, it's better I ask you. So, it's time. We've been talking about conception, inability to conceive, but now we want to talk about miscarriages. Things that trigger miscarriages, 2 months, 3 months. Some people at 6 months, 7 months. Some people, they just realize that the baby just stops kicking and then the baby is gone. And we also want you to spill it into people that are days to delivery, the baby is also gone, stillbirth, because these are all reasons why people are also expectant, because the baby just did not come eventually. And then things that might trigger, death in delivery.
Okay, thank you for the question. First of all, recurrent miscarriages. It's most of the time there is no known cause. You can't say this is the reason. But sometimes you can link it to so many things. Number one, the commonest cause is what we call chromosomal abnormalities. You might not know what that means. What it basically means is that, okay, our body is made up of gene. Gene is like, if you want to construct like this cathedral now, we put blocks together. Then we have this giant, this beautiful structure. So each of the blocks represent like a cell in our body. And the cell, each of the cell has, tabaru and okuta. Be dust. That's what we call gene. So sometimes there might be some abnormalities that would have happened during the process of conception. There are things that are not under our control and nobody can do anything about them, but they are there. That can be the reason, number one. Number two, another thing about recurrent miscarriage is what I said earlier about blood group incompatibility. There's something we call rhesus negativity. So a woman is rhesus negative. The blood group of the woman is maybe O negative, B negative. But the husband is B positive. And the woman is O negative. It basically means that the woman does not have what we call it antigen. Just ignore that language, but antigen. But the woman can mount response against anyone that comes in. So when this man and this woman meet and they have a child, Some people might be so unlucky. The child is also Rhesus positive. But the mother carrying that child is Rhesus negative. At some point, there might be a mixing of the mother and the baby's blood. And the mother's blood will create soldiers that will fight. Most of the time, it happened during delivery. So the baby would have been delivered before the mixing of that blood. So the soldiers have been created, but there is nobody to attack because you've delivered the baby. But the soldiers are still in the mother's body, so they are waiting for any other intruder. Subsequent pregnancy will go with miscarriage because the soldier keeps fighting every time a baby comes. They keep fighting to kill that baby, and that's why the woman will have recurrent miscarriage. Sometimes, some people are unlucky. The mixing of blood happened early in pregnancy. So the first baby will still die because they will march onto the baby and short the baby's life. That's another one. Another thing is what we call cervical incompetence. The mouth of the womb of a woman might not be strong enough for several reasons. It could be as a result of infection with chlamydia. It could be as a result of a previous instrumentation. At some point, a woman might have done what we call cervical biopsy. They want to do a test. They just take from the mouth of the womb. So that trauma of cutting some part of the womb will give some form of incompetence. It will not be as tight as it used to be. Sometimes, some people have had maybe a previous miscarriage that warranted evacuation, and something has been put into the womb. So the womb is not tight as before. So in that case, there can be recurrent miscarriage. And once you identify that it's cervical incompetence, there is something we can do to stop that, to prevent that from happening. Then what can possibly cause a woman to lose a child when it's very close to delivery? We call it intrauterine fetal death. That's baby dying inside a woman before delivery. There are different factors that could happen, which might be beyond the scope of this discussion. But most importantly, when a woman is pregnant, if it's her first pregnancy, about 16 to 18 weeks of being pregnant, that's roughly 4 months, the woman starts feeling the kicks of the baby. That is the most important indicator that the baby is alive. So we tell our mothers that whenever you feel that the kicking is reducing, I don't bother myself when a woman tells me that the kick is too much. It's not really nothing to worry about. But when the kicks are reduced, then you need to run. Don't come. Run to the hospital because there might be an impending danger. So, and that's a way to prevent it. Another thing is that some people see water. Sometimes what is coming out might not be the water from the baby, it might be urine. A lot of pregnant women pee on themselves. It's because they are not really under the control of their bladder again. The pressure from the baby presses the urinary bladder so much that urine just leaks out. But regardless, still go to the hospital for the doctor to confirm that, okay, this is not the water from the baby, but urine. Sometimes some people see water and they will just sit at home. And then there will be an infection that will ascend to where the baby is. It will destroy the sac of the baby to the point of killing the baby. We've had some terrible experience where mothers are coming, and by the time the baby is coming out, the entire delivery suit is a mess. Everywhere is smelling, which can even jeopardize the life of the mother. So it's important. For the pregnant women, the most important thing is the kick. Just pay attention to it. Once you notice that the kicks are reducing, straight to the hospital. Okay. There's a question about fibroid and what could be the possible cause. As I said earlier, one major factor that contributes to fibroid is exposure to
this chemical in our body, in the body of women that we call estrogen. The estrogen is what feeds almost all the female sexual organs, as well as the breasts. So, if a woman is constantly exposed to estrogen, maybe because of delayed marriage, to estrogen because of delayed marriage, then some part of the womb, the flesh of the womb, can start growing abnormally. You know, just let me relate this in this manner. You know, as a young man, if I'm getting constant food, like I'm not working, I'm just sleeping at home, and somebody comes in the morning, ofumini breakfast, ofumini brunch, ofumini lunch, ofumini dinner, what will I do? Mama Feni, I will just be Mama Toby. So the same thing, when there is constant supply of estrogen, the flesh of the womb start growing abnormally. And it will start forming something that looks like a ball. So it will start circling like a ball, and then the ball starts expanding. So the longer you get exposed to that estrogen, the more increase you have in the size of the fibroid. Exposure to estrogen is the primary cause. So if there is anything you can do to halt that, then you will reduce the duration of exposure. And one major thing is pregnancy. Very important. Then why do people bleed excessively? Because this growth will now impinge, it will disrupt the lining of the womb. You know, the womb is like a bag. You can put your hand inside it. The inner surface of it, when something is growing into it, there is an increased surface area. So that's what results into shedding of excessive blood. So fibroid will cause a woman to bleed more than usual. Some bleeding can be so severe that the woman can faint. You will see a woman with fibroid looking all white, and it has nothing to do with the size sometimes. The size just shows you, just gives you an idea of how much time the fibroid have spent in the woman. So, some people have tiny fibroid, but they bleed so heavily. Why some will have a very big one? The bleeding will still be much, but it won't be as much as those that has tiny. So it has nothing to do with the size. But once a woman has fibroid that has affected the inner surface of the womb, the bleeding will be excessive. And I must also say this. It's good I have this opportunity to demystify the ideology of a lot of our women. To my sisters, mothers, and friends, there is no drug. I repeat, there is no drug for fibroid treatment. We don't treat fibroid with medication. Not even agbo. No. The only treatment for fibroid is to take it out by surgery. That's the only treatment. If anybody tells you that, toba mukini, it's a lie. The only time we use drug for fibroid is when we want to, if the fibroid is so big that it will be difficult to bring out, there are some medications we can give that will reduce the size of the fibroid so that it will be easier to bring out. But even those medications that will make it easier, that will shrink the size, will make it even more difficult to shed out of the womb. So even though they have their advantage, they have their disadvantages. Thank you. Thank you so much, sir. We have, okay, Mom Bisikoga, you want to add something to?
The major thing, that's why I'm asking him. Because, no, we are Africans. Kò sọ́jà tí ò ṣèlérí ọmọ. Àwọn èèyàn dẹ̀ máa ń sọ fún wọn wípé fibroid o, àgbo ẹ̀ wà, àgbo ìjú wà pé tó bá ti ń mú ó máa shrink. That's why mo ṣe ń bi wọ́n wípé ṣé fún àgbo náà kò sí àgbo tá a lè lò fún fibroid. Ṣé wọn pé because we are Africans think bóyá àwọn bàbá wa ni bóyá wọ́n ṣe we think very archaically bá ṣe máa ń ronú. When there seems to be a way to do something, ìbẹ̀rù máa ń wà nínú ọkàn wa, mindset wa ó ti wà so much cultured tá ti rò wípé tó máa sọ wọn pé this is the road to this thing, there must be a shortcut. There must be a shortcut. Ọ̀pọ̀lọpọ̀ ń gbà mí it is the surgery tó ń bà wá lẹ́rù. Àkọ́kọ́ ronú pé òkè torí surgery tó máa ti fún wa alternative àgbo àlọ́gbàgbo tágbo bá work mọ́ àwa sí church àwa so mọ́ vision ni pé kí n má ṣe surgery. I'm not saying that there is no vision. I'm not saying there is no vision, and I'm saying that àgbo tá à ń lò ẹ jẹ́ ká ṣọ́ra. There are so many things that he has talked about. Wọ́n ní wọn tiẹ̀ mọ náà kò tiẹ̀ wọn mọ ọmọ kọ́ọ̀sẹ̀ wọn lè sọ pé nǹkan báyìí ló ń fà á ìyẹn nínú àgọ́ ara. Ká má ì máa introduce eléyìí táwọn agbọ̀ngàn wá ṣẹ̀ṣẹ̀ wá ń fọwọ́ ara wa kó sẹ́nu. Tá bá mu àgbo tẹ́nibọ̀dì bá má gbo Ìbàdàn nísìn kí náà fi ṣe wọ́n á to gbogbo ewé yẹn kí ni nǹkan tó máa ń cause tá bá lò ó kí ni dose tó yẹ ká lò. Àwọn míì wà tẹ́ pa máa sè àwọn míì wà tá a máa bò mọ́ra gbogbo kíní yóò dẹ̀ níbi tó lọ ṣe pé liver wa ẹyọkan la ní kidney ló pé méjì liver ẹyọkan ni tó bá dẹ̀ ti parí ẹ̀ báyìí that is the end of the story. And liver cancer of the liver is one of the deadly things we don't want to go about. So please let us be careful nípa ọ̀rọ̀ àgbo. And then I want to look at some of the questions that we have here. Ẹni sọ pé let me start from this. Only can irregular intercourse with your wife result to prostate cancer? Wọ́n sọ pé ṣé tí wọ́n bàbá ìyàwó wọn lò pọ̀ ṣó lè cause prostate cancer? There is a gland in a man that is called the prostate gland. Prostate gland enlargement don't cause prostate cancer, and that is it has to do with age. It depends on the age of a man. What is a prostate test ní church this year? We have drawn a prostate test and they've done cervical. Nínú test a ṣe cervical, I think women were about 70 something, men were about 25 or 26. Yes, they give you opportunity to do things like this. We don't see men come out. All you need to do is just check your prostate gland. If it is within the range, you are fine. And we should take it as I don't know what to like. Please take time to put down money. That's a medical checkup at least once a year. Ẹ jẹ́ ká tọ́jú àgọ́ ara wa. Ṣẹ́ni bá ṣe ń dàgbà sí gbogbo bọ́dì tá a ti ń lò fún wọ iye ọmọ ọdún tó jẹ́. Kó wá wò tó bá ní machine kan lé tó ti ń lò láti ọdún yẹn lójoojúmọ́ ló dẹ̀ ń lò. Kó wá wo bí machine yẹn tó bá wo iye èjẹ bí machine yẹn ṣe máa wà. Ẹ jẹ́ ká tọ́jú owó láti tọ́jú ara wa. Let us do a medical checkup. For men, it's not about sex. It's more about that prostate gland which has a link with your age. You need to check it often all the time.
All right, thank you so much, ma. We have some questions. In fact, we have a lot of questions, and because of our time, I want us to just hit it nail on the head. So this person is saying that, sir, this is okay. I think he's trying to say that he meets with his wife, but he only lasts for 3 minutes. So he spoke with his friend, and then the friend said he should try Bullet Blue and Giacomo. Is it Bullet Blue or Bulletproof? I don't know, but I think it's Bullet Blue. He said Bullet Blue and Giacomo, that when he uses it, it will last. So apparently, he tried it, and he said, "Doctor, it worked." So the question now is, what are the effects of Giacomo and Bullet Blue?
Please, we need to see that. I don't want us to dwell too long. Talking about people that are waiting for children, just sex.
if you ask me, Giacomo and
bulletproof.
Giacomo, okay, bulletproof. Okay, it has worked now. You might be lucky that it will work again, but to get to a time it will not work again. A lot of people that uses things like Viagra, that's even what will cause erectile dysfunction for them. Some people, they don't have problem with erection, but they want to last longer. And the drug will now come back with a ripple effect, which is nothing good.
All right, thank you so much. 2 questions for you now, then we also move to other questions. This person is saying, my sister does not see her period unless she uses drugs, and she's always having headache. So now she's afraid of getting married. We have gone to different hospitals, but yet no solution. What can we do, please? And the second one is, how does lactation affect infertility? How can one treat it? Because I've used lots of Dostinex. What else can I use?
Thank you so much, sir. My brother here is doing the work of a doctor. He has compartmentalized the question because these 2 questions are linked together. In fact, they are basically the same thing. So, a woman having constant headache, no menses, in our body, there are some chemicals, we call them hormones. I'm sure in biology you must have heard of hormones before. Now, those hormones, those chemicals, their production is from some part of our body. We can't see them. We call them endocrine glands. They are tiny part of our body that produces hormone. And one of them is seated just at the base of our brain. It's called pituitary gland. And that pituitary gland produces a lot of hormone, at least minimum of 9 that affect different part of our body. Sometimes the gland that produces this hormone gets enlarged for different reasons. One of them, when a woman is pregnant, the hormones that need to sustain that pregnancy must be controlled from there. So the gland gets enlarged in order to meet that demand of the body. Now, when a woman is having headache, the brain of a man now, not a man, like human, the brain is an enclosed cavity. Nothing else can stay in our brain except the rightful occupant. Be some white cyst discharge. And that breast milk will affect the woman's fertility. Because those 2 things don't happen at the same time. And that is the same reason. I think there is another question whereby a woman is asking about the relationship. Somebody is asking about the relationship between breast milk and contraception. And that is why when a woman is breastfeeding a baby, it is not total, but to a reasonable extent. When a woman is breastfeeding a baby, she's more...
42 for sperm count, but they are not active or they are headless because it is actually the head of the sperm that will fertilize the egg. So, electory about to get down, abito sluggishness, àwọn míì ti kọjá lọ sí wọn tó bá lélẹ̀ tó sluggish, they have told us it's just 72 hours that he has to spin there. So if he has no sperm count, but he has active, very active, and sperm count that have the head, they can do. If the woman has fibroids, I think we've spoken so much about fibroids today. They've told us the best way for you to be at peace with fibroid is to get it out. It's Sherry, àwọn odò kan àtàmà kọjá nílé ayé wa. Kò sí gọ́tà máa ṣe. You ká lọ pẹ̀lú Kristi, ká lọ pẹ̀lú Jésù. Torí ẹ̀ làwa ṣe jó nígbàgbọ́. Tá bá ní fibroid, a lè jókòó sílé ká máa ní lórúkọ Jésù. Ìgbàgbọ́ tí ò bá ti sí iṣẹ́, kí ni Bíbélì pé? Ó ló kú ni. Ó ní tá bá ṣe ohun gbogbo tó ní ká wá dúró. It is then that we can now wait and say, God, I have done all that I need to do. I am now waiting for you to do the best that you are going to do. You will now do what no man can do. But the one that you can do for yourself, please go and do. If you have fibroids, please go and get it removed. He works at the Solo General Hospital. So you can just get across, and if you have fibroids, please, come on. You can go and get it removed. And depends on, like I said, depends on the location of the fibroid. If both of you don't want to do that, you are afraid. There are so many options. You can go for IVF. Let us look at where the thing is. Science is so vast now. You can do surrogacy. Only harvest family kan gbe egele. Kon we nikan to ma ba yin gbe oyún. Ade bímọ ko se ni yen lo ni orúkọ yin yin na le lo ọmọ. So many ways you can do adoption. A lè lo adopt ọmọ. Kò sí tó ń ṣe wá. Kò ní fún wa ní cancer, kò ní fún wa lẹ́gbórí. All these are things that are relieving us. Please, I want us to shake our mind from what people will say concerning the way we live our life. Ó ní wá kan sọ, ó ní kí la ó rò kí la ó sọ. Nígbà tí bàbá pè wá, wípé ọmọ ṣíwọ́ kó máa bọ̀. Kò sọ pé kí ni àwọn èèyàn máa sọ. Kò sọ pé kí ni ẹgbẹ́ máa sọ. Kò ní kí ni ìjọ máa sọ. Ìwọ gangan ní kí ló máa rò, kí ló máa sọ. So this is all about your life. Bó ṣe ń gbélé ayé ìwọ ló máa ní láti nǹkan tó bá fẹ́. Let us block our mindset to what people will say, what people will think. What we want is what we should do. And in all this, some of us know we don't like children. There's some people don't like children. There is no harm about it. Kò sẹ́ṣẹ̀ ń bẹ̀. Kò sí wàhálà. You don't like children. Look at yourself and tell yourself, I know I cannot bring up a child. I don't like children. And tell yourself, and when anybody talks about, I don't want children, and that is my case. So let's just face our realities the way they are. Thank you.
Okay. Another quick one. I have a sister, 39 years married, and 39 years old, married, but still expecting. Like 7 years ago, a doctor told her to try another man to be sure she's okay medically, but she refused. Now the husband has 3 kids outside marriage, but though she's still with her husband, medically she's okay with series of tests. What is the problem? 11 years in marriage.
But number one, as she and the husband gone to the hospital to do tests together, the husband, is he sure he's the owner of the 3 kids? The husband that says the husband has brought 3 kids. It's just because of shortage of our time. I have a colleague of mine that was married to a man that is a doctor that knew that he had no sperm count. I don't know what happened, maybe Shegede or so, when he was young. And he did not disclose to the wife. And they were married for like 18, 15, 16 years. The guy was a high-pro person working in a bank. And every time the family of the man would come and be taunting her, the guy will bring notes and say, well, and one of the friends of the guy now called the lady and saw the way to touch your lady, you work me. They were test. Test. If that's why test, the 2 of you go there and go and do the test. Then the test, you want to call up by result. Someone can go Wednesday, no call up by result. Why the Tuesday? Call up by result. She was able to lure the man to go and do the test. They did the test, she went to collect. And that was when she found out that the man had zero sperm count. And you know, this is somebody that's been tortured and all that. She said, only so the first thing is, and the man came and called the whole family meeting. And she now brought her letter and said, come. And this is the man that will bring note every day. And say, well, any country is sharing for me. You know, and that was when she now brought out the note and showed the man and said, Oga, you are a doctor, see you. Have you seen this result before? And the mother of the man now came and said, doctor. So the whole family knew. They thought the man had taken something against the woman. And the man had done nothing. 6 months after she left the man, so the man having 3 kids, is he sure he's the owner of the 3 kids? His plan B. Sometimes our plan B, it might not even be what we think is the plan. Our actualize it, it might not be what it is. But she knows that she's getting older. Let her do other alternative means of getting children. She can discuss with the man. She wants to be meta. But you can't just IVF go somewhere. She won't need meta. Oh, you agree, con let your come. But she's already getting adoption. Let her go and do something, please.
And please, Mommy has mentioned something very important before. We need to be conscious. It's all about our mindset. Adoption, IVF, surrogacy. It's all about your own mindset. Don't let's be ruled by what will people say. A child is a child. Look at what works for you and your husband. That's all that matters the most.
All right, thank you so much. Doctor, we have questions, and I'll just read out two to you now. Apparently, this person carried out a scan result. So the impression is, the first one is viable first trimester cysts. Then the second one is left ovarian hemorrhagic cysts. I don't know this language.
Let him read it himself.
Let me read the language I understand. I was 5 weeks pregnant and started bleeding for 2 weeks, but I lost the pregnancy. What possible solution can I do to prevent such from occurring? And age is no longer by my side. Please, this one also. What are the dangers, if there are any, of giving birth above the age of 40? So, those 3 questions.
Okay, thank you. So the first one, this person is basically asking me to interpret a scan result. So it basically means that you are pregnant and you are within your first 3 months of being pregnant. Second one is now saying that you have a left ovarian hemorrhagic cyst. That doesn't sound good based on the result. But if you are in church, it means you are fine. Now, what it basically means is that, that report, the second part of the result of the report, it's a bit scary, but it's nothing to worry about. If you are not having excruciating pain, if you are not having pain. So I would like to explain what a cyst is. Emotaba muoson. Emo pe àwọn bí ó ní àwọn kìnnì kan bí ball kékèké tó wà nínú ọsàn yẹn ibi tó mi ti máa ń jáde. That's what cyst looks like. So some of them, àwọn cyst yẹn gangan ibẹ̀ ni ẹyin tó máa ń di menses ti máa ń jáde. So some of the cysts téèyàn bá lóyún èyí tó yẹ kán fi parẹ́ wọn ò ní parẹ́. If ẹni tí ò lóyún náà ó lè wà lára ẹni tí ò lóyún ó máa wá get enlarged. But if it's not causing a problem, it's nothing to worry about. But there are 3 things you don't want. Number 1, you don't want that cyst to get infected. Number 2, you don't want that cyst to rupture. Burst. Number 3, you don't want that cyst, you don't want to bleed inside it, which is what they are saying is happening here. But if a woman is having an hemorrhagic cyst, which means the woman is bleeding into the cyst, I don't expect such person to be in the hospital. However, this is a scan report. Sonologists, their experiences differ. And nobody is an island. And it's a subjective area. When I say subjective, for instance, pain doesn't lie. If I have headache, I have it. But if you come to me as a doctor and you tell me you have headache, you are the only one that can describe what you are feeling. But if you tell me I have hot temperature, I have thermometer to check if truly you have. For something like this is a sonologist. Ó lè rí kó sọ pé ó wà ńbẹ̀. Ó lè máa rí nǹkan míì kó sọ pé ọ̀tọ̀ ni nǹkan tó ń rí. Because there is also a place of having experience, and when you see what you are seeing, are you sure that is what you are seeing? God help us in Jesus' name. But for me, there is no issue. Okay, I was 5 weeks pregnant and started bleeding for 2 weeks. But I lost the pregnancy. What's the possible solution? What's the solution? What can I do to prevent such from occurring again? And age is not on my side. Yes, age is it's one major factor. And as I said earlier, I said something about chromosomal abnormality. I would advise such person, from now on, start taking folic acid. There are some conditions, some medical condition that has been linked to advanced maternal age. If a woman is more than 30 before being pregnant, there might be a problem. And one of them might have resulted into a miscarriage because there can be chromosomal abnormality. Things like Down syndrome. You see some children, they have it's commoner among people that are above 30 that are carrying pregnancy for the first time. And that chromosomal abnormality might have resulted into the miscarriage. Second thing, the person should start taking folic acid from now and try again now. Because the longer, one thing about, we advise people that, try Latife to summer baby. That language is not for somebody that is already in our late 30s. You need to try. So if you now have one, you can now do to summer baby, or you can even try another one. So long it's not CS, because you need the scar to heal very well. So, folic acid, and then the most important one is this last one. Immediately you realize you are pregnant again, straight to the hospital, so that we can look for why and what might have caused the first one, and we can do everything possible to prevent another one. Then, what are the dangers of giving birth at age 40 and above? Is also linked to this. Number one, somebody can have a malformed baby. Problem with the face, cleft lip and palate. You see some babies, anyone majak or moimu, heart problems. They can have hole in their heart. You can have Down syndrome. They can have all forms of syndromes. They can have miscarriage. Those are dangers. And the reason for these dangers is the fact that, imagine, you can't compare the quality and quantity of the egg of a young child or of a young lady between the age of 22 and 28 to that of somebody that is in her late 40s. Imagine you have a sack of seed and you are picking from that sack to plant every year. By the time you get to 40 years of planting, the remaining seed, their quality, the yield will not be the same to when you started. So the same thing is what you have in women. And another thing is that a woman, a girl child, right from the mother's womb, all the egg that girl child need to function throughout her lifetime has been deposited. While the girl child is in her mother's womb, she has about 500 to 700 million eggs. By the time the girl child comes out, the egg would have reduced to about 200 to 300 million. By the time the girl child gets to puberty and start menstruating, it would have reduced. They would just be dying, nothing. It would have reduced to about 300 to 500,000. And every month, she will lose one as menstrual period. For everyone that comes out as menses, about 20 or 30 are wasted. If you do the mathematics, by the time that woman is about 48 to 51, she's in menopause, which is what differentiates a woman from a man. A man will continue to produce sperm throughout her lifetime. And that is why every female should act now. But as our mother said, there is already advancement in medicine. I've had an IVF patient at 55, she delivered twin. I've had an IVF patient at 50, she delivered triplets. So there is nothing impossible. But this is the time to take a step. Thank you.
Thank you so much. Thank you. Please clap for him, please.
Even in addition to what you said, we've heard of technology now. Women are storing their eggs for the future. So you can actually store your eggs and store your sperm. You freeze it, yes, that's what it's called. You freeze your eggs and your sperm. It's not your freezer at home.
Something similar.
For the future.
Emma lost store eggs in freezer and in Lewis. It's a special freezer, yes, so that people don't start storing. All right, thank you.
Okay, another quick one. I have a kind of marriage, but After marriage, I didn't get pregnant. I discovered my husband has watery sperm, and I've told him, but he said nothing is wrong with him. I'm 8 years in marriage. What can I do? But I don't know. I don't have a problem because I went for checkup. Sir, how true is it that excessive... Okay, how true is it that excessive pimples in all parts of the body of a young lady age 18 to 22 can cause infertility? Pimples, 18 to 21. Excess pimples, can it cause infertility? What? No. Excess pimples, can it cause infertility? Okay. What drugs can be recommended? Okay. Is there any tendency for anyone that is in her 50s and yet to get married to have a baby? Is it good to wash the outer part? Is it good to wash the outer part of the vagina with soap? I don't know. Then there is...
Science says is that if you've been pregnant before, of course you can be pregnant again, so long there is no abnormality in all the process. So the person should just keep trying, have more regular intercourse, and also pray to God. Excessive pimples, can it cause infertility? So usually having pimples is one of the ways that one will be able to identify secondary sexual characteristics. When a male child crosses the age of 13 and the voice start becoming deep, the child start having pubic hair, armpit hair, the phallus start getting bigger and things like that. Those are signs. And one of the things that can accompany that is that the child can have pimples, either male or female, but it's commoner in male. But there is a period that pimples is expected to regress. When it becomes what we call acne, especially what medical experts call nodulocystic acne, they become so big that some of them can cause pain. There is need to check. Just take that child to the hospital. They just need to test some hormones. If their levels are normal, then it's nothing to worry about. Okay, a girl child having constant pain at 9. Females get to achieve menarche earlier than male child. And what that means is that a girl child between the age of 9 and 13, some people, between age of 9 and 13, they can start their menses. But at that period that the child is preparing to have her menses, she can have constant pain because the ovaries are not fully developed. So the process of development and expansion brings about some stretching and it brings about pain. So that pain can be constant. But the pain is not expected to be for too long. Once the pain is getting out of hand, then you need to seek medical attention. And the pain is not something that should be out of this world. Once a child is unable to go to school because of such pain, then there is a problem. We need to look inward. And also, let us be sure that there is no form of ulcer. We need to take this child to the hospital. That's what I mean. So that we can check that there is no ulcer.
Is any issue really? I think I'll talk to the men particularly. If there is any issue really, I don't think it's out of place as a man to follow your woman or your wife, not even or your wife. I don't think it's out of place to follow your wife to an hospital to do a checkup. Ẹjọ́, orin kan tí àwọn obìnrin kọ tó ní kí n kọ fún yín, ṣé kí n kọ? And that song is Má ṣe dá mi dá bùkátà mi ò baálé mi. Do you get? So baálé ẹjọ́ ẹ má ṣe dá wọn dá kí ni? Ẹ má ṣe dá wọn dá bùkátà in the name of Jesus. All right.
Okay, let's have this quickly. Vasectomy. I thought this was also very important. What's the cause of, what is your view about vasectomy? What's the cause of infection, coliform and varicose? Is it coliform and varicose? And what's the solution? Okay, varicocele.
Okay, my view about vasectomy.
vasectomy is a form of ifetosomo bibi that is done by the men, not the women now. You know, most of the contraceptive method available, majority are for the females, ranging from diaphragm to female condom to OCPs to implants to injectables and all.
Hysterectomy.
Yeah, but yes, but for male, if you feel you've completed your family size as a man, you can do a vasectomy. What they will just do is to cut the pipe that connects the testes.
They don't want to hear the word cut.
Okay, it's just to cut the pipe connecting the testes to the penis so that sperm doesn't flow out. And that's all. And it doesn't affect your performance as a man.
Doctor, that cut you said, because I don't know why there's noise, but is it that cut is painful?
No, it will be done under anesthesia so you won't feel anything.
What kind of question is that? When a woman's, when the baby is too big and cannot come out, what do? They cut the vagina, is that not so? When you want to have a CS, what do? They don't just cut, they tear it. You have a problem with
Men, do we agree to cutting?
Yes.
Do we agree to cutting?
Oh my shit.
Okay, so the last question here is, what is the cause of infection with coliform and varicose? What's the solution? Okay, so those two questions is actually, that question is two questions in one. There are two different things that are not related. So coliform is a form of bacteria that is seen commonly in people's urine and in the stool. So sometimes it's common among the elderly. There is another counterpart called E. coli. It affects younger people more. But the E. coli is even the major one that causes urinary tract infection. And it's usually from our feces. And it affects the female more. Reason being that ilé ìgbẹ́ àti ilé àti ojú ara obìnrin, they are very close. There is a very close proximity. So they can easily flow down. So that's why our hygiene is important. Washing outside and the surrounding is very important to prevent any form of contamination. Then varicocele, I really like that question. You know, what we do, but also ignorance is not an excuse. Mi o mo is important to know. Àwọn ọmọ wa ọkùnrin, ẹ jẹ́ ká máa ṣe nǹkan kan fún wọn. We need to examine their balls, the testes. Sometimes, if you examine a child's testicles and you find out that there is something like a bag of worm, odabi noodles or iron. Mi mo bóyá ti rí àwọn èèyàn tó máa ní varicose vein. Tí vein máa yọ irú vein yẹn gangan irú iṣan yẹn ó lè wà ní orí kórópọ̀n ọmọ kékeré ọmọkùnrin, ó lè wà lórí ìtàgbàlagbà náà. And what that basically means is that blood tó yẹ kó máa flow kò flow. Those veins, they've lost their what will I call it now? Their elasticity, so to say. So they are now they are lax. So blood will pool inside that place. And too much of blood, the blood is meant to be free flowing. When there is pooling of blood, it causes a lot of damage to those testicles, and that can result into infertility. And that condition is something treatable. They just need to remove the bad veins and leave the good ones. Thank you.
Thank you so much. Because of our time, I'm going to throw two questions to Mommy Coca and Doctor. It's the same question. We can't take this question again because of our time.
I entered menopause accidentally.
Okay. In 30 seconds, Mommy BC Coca.
I entered menopause accidentally at age 38. After 5 years after 5 years.
That's premature ovarian failure.
Yeah, premature ovarian failure. At 43 years, my period started coming again, sometimes for 7 days. But the issue I have now is that I hardly have orgasm.
Does he want to get pregnant?
I don't know.
We are talking about the expectant and all that. The person might need to go and see a doctor. Because, sometimes all these things that you are asking, it's just like within your body, there are so many things that are inside the body that looking at you physically outside is very, very difficult for us to say, there are sometimes that you need to carry out some tests. Àwọn tests yẹn ló máa jẹ́ bí determining factor tá a máa fi wò pé òkè eléyìí lowing point eléyìí 4 ló yẹ kó jẹ́ ó ti jẹ́ 8 eléyìí 6 ló yẹ kó jẹ́ ó jẹ́ 2. So many of the times when you write out things like this, it's very difficult for the doctor to just start telling you can prescribe and say all this. But most importantly, there are so many things that you still need to do more. You need to visit the hospital, let them carry out tests that relates to what you are talking about. And that is where we can find solution to whatever the problem is.
Thank you so much. So just 30 seconds, the 2 questions.
It's about expectant mothers. Sorry, before the question.
Okay.
And like one major psalm that we read for expectant mothers is Isaiah 54. For anybody that is waiting on the Lord, no matter your age, the doctor has just said what he wants to say. That is what the science has said. But you know, science did not create you. One person that is the creator of heaven and earth has created you and is aware of your situation. It now depends on the relationship that you have with that God. It doesn't matter. At 35, automatically 35 it can be down. I had my children at 44 and none of them is down. Both of them are up. You understand? So I'm telling you what Isaiah 54 has said. Please take it to heart. He said, Kọrin ìwọ àgàn. He's not expecting you to be downcast. Even táwọn èèyàn bá sọ̀rọ̀ sí ẹ, má gborí sọlẹ̀. Gbé ohun ẹ̀sùn, ó ní ké rárá. Ó ní nítorí sọ ibi àgọ́ ẹ di gbígbòrò. So you don't sit down within your territory and think that is where the solution is. Tó bá rìn lọ gbogbo ayé ló ń rí ẹbẹ nípẹ́ni tí ò bímọ. Stop thinking about yourself like that. If God could give Sarah, if God could give Rachel, if God could give Mary without having conception, yours is not an exception. Whatever the situation that you are in, get up, take a decision, go and do something today. The major problem is not doing anything. Dìde, bẹ̀rẹ̀ sí ní gbàdúrà, back àdúrà ẹ pẹ̀lú whatever spiritual, physical, medical things that you need to do. Confirm with your husband and God will do it. Ẹ jọ̀ọ́, àwa tá ilẹ̀ ti bímọ. Ó ṣe wà tábàdé band. Ó ṣe ọkọ mo ti sọ́rí. Ó ṣe wà tábàdé band wọ́n fẹ́ gbàdúrà fún àwọn tó wojú lu wa. A máa wò pé lágbájá ẹ̀ẹ́dẹ̀ jáde. Torí pé àwa ti bímọ. Please, when we are praying, ẹ jẹ́ ká máa gbàdúrà nínú ilé wa fún wọn. Ó ṣe gbà tábàrí wọn. Tábàrí ẹni tó bímọ tí ẹ náà á dé o. Ẹ hàn díẹ̀. Ẹ ṣe. Ẹ ṣe. Ẹ bá máa gbàdúrà. Ẹ gbàdúrà nínú ọ̀tá yín. Ẹ máa dárúkọ wọn níbi tí wọn kò sí. Ọlọ́run sọ, ó ní tó bá gbàdúrà sí mi ní kọ̀kọ̀, ó ní gbangba ni mo ti máa dáhùn. Táyọ̀ ẹnìyẹn bá dé gbogbo alámájíjọ yọ. Kò ń ṣègbà tó bá rí níta tó bá ń sọ fún mi pé tiẹ̀ náà dé ẹ pọ̀lọpọ̀ ní wákàtí mo máa béèrè question ṣe ti lọ sí hospital. It is not our goal mọ́ tó ń ṣẹlẹ̀. So many of the times expectant mothers don't know what is happening. And so many of the times we are not even in the good frame of mind. We just don't even want you to talk sometimes. We just want to talk. We just be with us. Ká jíjọ ṣe yẹ̀yẹ́ ká ṣeré. Kóníkálukú máa lọ má tiẹ̀ sọ̀rọ̀ nípa mo bímọ mi ò bímọ. Ṣé tó bá ń gbàdúrà máa gbàdúrà fún wa nílé? Má déta má máa sọ fún wa pé kíníkan káwọn ọmọ mi tẹ̀ wá lọ bẹ́ẹ̀ ṣe tọ́jú àwọn ọmọ tiẹ̀. Àwọn tàdé ń wojú Olúwa náà. Ẹ jẹ́ ká rántí pé ẹ jẹ́ ká fọkùnrin ẹ jẹ́ ká mọ àwọn ọkọ wa. Let them be in agreement with us. But I want women to know. Eléyìí tó bá bí ẹnu ìnà ọ̀nà yàrá ẹ̀ ló máa mọ̀. Ẹni tó ló bímọ mẹ́ta ó bímọ mẹ́rin. Ìjọ́ tó bá máa gbé padà wá tó wá sọ pé òun kọ́ lòun lọ́mọ. The man will be the one that will be ashamed. Fight your own battle and choose battles that you are going to fight. Bó ṣe gbogbo ìjà ló máa bọ́ kọjà. Ìwọ tó dẹ̀ sí wà tó ń retí Olúwa fún ọmọ, wọ́n ti sọ fún ẹ pásùn lé lórúkọ ẹ. Bó ṣe wà tọkọ bá dé tó bá lọ yá ká sùn ìgbà yìí ló máa ní ó rẹ̀ mí. Àjìjà lọ látàárọ̀ ni. Àsùnlé ló ń jẹ́ báyìí. Tó bá yá o sì máa porúkọ dà. Bọ̀ lọ́wọ́lọ́wọ́ tó wà ńlẹ̀ ń sìn. Kí ni mo porúkọ ẹ?
Àsùnlé.
God bless us in Jesus.
There's absolutely nothing to add again. Doctor, in 30 seconds or 45 seconds, just give us a parting shot and we call it.
You should give up. Oh, okay. I want to appreciate everybody that has been listening to us, and I pray God will help us all in Jesus' name. The most important thing is that we should have a good health-seeking behavior. And we should be mindful of where we go for help. It's very, very important. And it's not, whatever works for one person might not work for you. So go to the hospital and seek the right help that you need. And God will help us all in Jesus' name.
Amen. Amen.
Thank you so much.
Can I take this? Yeah.
This is where I want us to start from.
Nígbà tí wọ́n máa bẹ̀rẹ̀ ọ̀rọ̀ yẹn fún wa lénìí.
When the word was about to start this morning,
Wọ́n sọ wípé ọ̀pọ̀lọpọ̀ máa rò wípé nǹkan tó ń sọ yóò kàn òun.
most people will think that what they're about to say does not concern them.
Bóyá mo ti bímọ mi ní ìdí àti
Or
gbọ́.
I've given birth, I don't need this message.
Àbí mi tí ì ṣetán láti márì mi nílò
I
àti
am not even ready to get married, so I don't need this
Ṣùgbọ́n mo fẹ́ kó
message.
o mọ̀ lénìí wípé
But I want you to know today,
kì í ṣe ọkùnrin tàbí obìnrin tó ń wá ọmọ nìkan làgàn.
it's not for the man or the woman looking for a child that are barren alone.
Ṣó gbọ́ mi dáadáa?
Are you listening to me?
Kì í ṣe ọkùnrin
It's not for the man
tàbí obìnrin
or the woman
tó ń wá ọmọ.
looking for a
Nìkan
child.
làgàn.
It's the barren.
Ìwọ tó sì ń ṣerú lábẹ́ ẹni tó jùlọ àgàn ni ẹ́.
You that you're a slave under the person you are even more than in age, you're also barren.
Ìwọ tó jẹ́ pé gbogbo ìrìn àjò rẹ ló ṣàfihàn tiraka ló sì ń fà á. Ó rí mú àgàn ló sì
That
jẹ́.
all throughout the journey you are struggling, you are still barren.
Ìwọ tó jẹ́ pé ṣe máa rìn nílé wa.
This is how we walk in our own home.
Èmi náà dẹ̀ ti ń rìn nílànà yẹn.
And I'm also going through that process too.
Nǹkan kan ti ṣẹlẹ̀ láàrin.
Something has happened in that.
So ohun tí mo fẹ́ kó o gbàdúrà lé lórí ni
What I want you to pray over is,
Ọlọ́run
oh Lord,
ohun tó sọ ni wípé
what you say is that,
ẹ máa bí sí.
that go and multiply
Ẹ máa rẹ̀ sí.
and replenish
Kẹ̀sì máa gbáyìn
and
lórí
begin to
ẹ̀.
replenish upon the land. Oh
Wọ
Lord,
inú ìrìn àjò mi lọ.
Lord, enter into the journey of my life.
Níbi gbogbo tí mo ti yàgàn.
Every area I am barren.
Ọkọ tí ò lè ṣẹ̀tọ́ mọ́ àgàn ni o.
The husband that cannot provide is also barren.
Obìnrin tí ò lè tọ́jú ọmọ mọ́ àgàn ni.
Even that woman that cannot take care of his children is a
Àgàn
barren.
tó wá burú jù nísìnyí ni
Even
wípé
the worst one that is called barren,
òbí tó pe ọmọ rẹ̀
that parent that called his child,
tó ń sọ fún wípé
and you're telling the child,
ó rọ́mọ ìyá ṣẹ̀rí
look at
lẹ́kẹ̀jì.
that child, that my name
Fóònù fún màmá
bought the
ẹ̀.
phone for the mother, that's a car for the
Yorùbá ní
father.
ọmọ ẹ̀ ò ṣàgbàfọ̀.
Even the heart they say your
Ó
child
kẹ́sọ̀ wálé.
is not what doing something, but it's bringing good
Ọjọ́ tó
things.
ti mú fóònù wá fún ẹ.
And the day he has been bringing that phone,
Tó bá dé stage tó jèrè ọmọ
and when he gets to that stage, you could not stay.
Gbọ́dọ̀ kún èmi ọmọ.
My mouth must not go sour,
Ó sọ fún mi wípé
because you have told me
olúkálùkù ni yóò ru àìṣedédé
that
ọ̀rẹ́.
everyone will bear his consequence,
Ìwọ
his
tó
sins.
wojú Olúwa fún ọmọ.
You looking for the fruit of the womb,
Bẹ̀bẹ̀ fún àánú.
ask for mercy.
Ó ní àánú ṣògo lórí
He said,
ìdájọ́.
mercy supersede on the
Jésù
throne.
mo wà níwájú rẹ
Lord,
lónìí.
I am before you this
Ọlọ́run
morning.
jẹ́ kémi náà rí ìbápàdé
Lord,
rẹ.
let me have your encounter.
Ọjọ́ tí Sarah máa bá Ọlọ́run
And
pàdé.
the day Sarah encountered the Lord,
Ọmọ pọ́jọ́ yẹn lọ́lọ́run máa dáhùn.
he never know that this day is
Níbi
going to
tọ́lọ́run
answer
tún ṣe
her.
dé.
And when God was about to do
Ó
it,
rẹ́rìn-ín.
she laughed.
Ìgbà tán ti jẹ màálù.
And after they've given
Wọ́n
them
ti
enough,
mọtí.
they have drunk.
Wọ́n ṣe ní salvation.
Why won't they say vision? But
Ọlọ́run sọ wípé
the Lord says,
ní ìwòye ọdún tó ń bọ̀.
by this time next year,
Ìwọ tó gbàgbọ́ ọ̀rọ̀ yẹn pẹ̀lú mi.
you that you are believing the word with me,
Níwájú àṣẹ̀dá rẹ tó
before
dùbúlẹ̀.
your creator there, you are lying and prostrating.
Níwájú Ọlọ́run rẹ tó dùbúlẹ̀
Then
sí.
before your God, you are
Ó
prostrating.
ní ní ti ṣe ọwọ́ mi.
He said, by the works of my
Ẹ
hands.
pàṣẹ fún mi
He
lọ́sàn.
said, command me.
Ọlọ́run ní ìwòye ọdún tó ń
Lord,
bọ̀.
by this time next year,
Mo fẹ́ kó o fi ìgbàgbọ́ bẹ̀rẹ̀
I
ni o.
want you to act with your faith.
Ní ìwòye ọdún tó ń
By
bọ̀.
this time next year,
Ọlọ́run dá mi lóhùn.
Lord, answer me.
Ìwọ tó ń retí nǹkan kan.
You that are expecting
Ó ṣe
something,
pé bó ṣe ń fọwọ́ tì í ló ń bàjẹ́.
as you are doing it, you are not prospering.
Ó jẹ́ pé iṣẹ́ rẹ ò mú èrè.
And your work is not producing.
Láti ẹ
Lord.
náà.
Say yours
Ohun
now.
tó wà ní ọwọ́ mi.
That thing in my hand,
Tí
Lord,
kì í kọjọ.
that does not gather.
Ohun tó wà lọ́wọ́ mi.
That thing in my
Tí
hand,
kò ń mú èrè
that does
jáde.
not bring fruit.
Jésù jọ̀ọ́.
Jesus,
Ẹ
Lord,
jẹ́ gba ìtúsílẹ̀
let me
lónìí.
release
Mo
the
kọ̀ láti
delivered.
wà bí mo ṣe wà
I
tẹ́lẹ̀.
refuse to be the way I
Mo kọ̀
am.
láti wà bí mo ṣe wà
I
tẹ́lẹ̀.
refuse to be in the same
Ìwọ
position.
tó ń wojú Olúwa fún ọmọ.
Looking for the fruit of the
Má
womb.
dúró dè mí o.
Do not wait for me.
Gbàdúrà yìí dáadáa.
Pray very well.
Sọ fún Ọlọ́run.
Tell the Lord.
Tó bá jẹ́ pé o mọ̀ pé ẹ̀fọwọ́fà ni.
If you know it is my self-affliction,
Tó bá jẹ́ pé o mọ̀ fún ẹ̀fọwọ́fà ni.
if you know it is my self-affliction,
Máa
Lord,
bẹ́ẹ̀.
begin to ask.
Aláàánú olóore
He is full
ọ̀fẹ́.
of compassion and grace.
Ó ní wọ́n ṣàánú fáwọn tẹ́mi ó
I
ṣàánú.
will have mercy unto whom I will have mercy unto.
Bẹ́ẹ̀ lónìí.
Begin to plead to him.
Nítorí pé ẹ̀dá rẹ ló dá mi.
Because you are he's the one who created
Ọlọ́run
you.
dẹ̀ sọ fún mi wípé.
Lord, you tell me
Kò sẹ́ni tí yóò yàgàn nínú ilé
that there
mi.
will be no barren in the
Ọlọ́run
land.
mi ò gbọ́dọ̀ yàgàn.
Lord, I must not be barren.
Jésù mi ò gbọ́dọ̀ yàgàn.
My Lord Jesus, I must not be
Ẹ fi
barren.
àánú pa ẹ̀ṣẹ̀ mi rẹ́.
Lord, with mercy, wipe away my
Ẹ fi
sins.
àánú pa ẹ̀ṣẹ̀ mi
Lord,
rẹ́.
with mercy, wipe away my
Tó
sins.
bá jẹ́ pé ègún ni.
If it is a curse,
Tó bá jẹ́ pé èpè ni.
if it is a curse,
Bíbélì sọ wípé
the Bible says
kò sí ègún mọ́ ní
there's no
Ísírẹ́lì.
more curse in Israel.
Ọlọ́run o.
Lord,
Ipá ègún àti agbára ègún
every power of curse upon
tó
me
dá inú mi dúró.
that is sealing up my womb,
Tó dá ọkọ dúró.
sealing up my husband,
Tó dá iṣẹ́ mi dúró.
sealing up my work,
Tó dá òwò mi dúró.
that is disturbing my
Jésù
business.
lónìí.
Jesus, today,
Ọlọ́run ẹ mú wọn kúrò.
Lord, take them away.
Àánú mi ni ó ṣe.
Lord, have mercy.
Àánú mi ni ó ṣe.
Lord, have mercy, Lord, upon me.
Ó ṣàmọ̀ pé mi ò lẹ́nìkan o.
I have no one, O Lord.
Àánú mi ni ó ṣe.
Lord have mercy upon me.
Àánú mi ni ó ṣe. Àánú mi ni ó ṣe. Ó ṣàmọ̀ èmi ò lẹ́yìn kan o. Àánú mi ni ó ṣe. Gbọ̀ngàn lẹ́ẹ̀kan sí.
Let's sing it one more time.
Nítorí pé bàbá ò lè ràn ọ́ lọ́wọ́.
Because I know your father cannot help
Ìyá
us.
ò lè ṣàánú ẹ̀.
Even your mother cannot come to your
Tí
help.
Ọlọ́run ò bá fún wọn lóore
If
ọ̀fẹ́.
God has not given them the
Ariwo
grace,
pẹ̀lú gbogbo ipá àti agbára
with all
rẹ̀.
your strength and your power, shout. Tell the Lord,
Mi ò gbọ́dọ̀ kúrò bíbá bí mo ṣe wá.
I must not live the same way I came
Sọ fún
here.
Ọlọ́run,
Tell the Lord,
ẹ dáwọ́lé inú mi.
Lord, place your hands upon my womb.
Gbogbo tó wà níbẹ̀
Everything in it
tí kò gba ọmọ dúró.
that could not take up a
Ohun
child,
gbogbo tó wà láyé mi
that thing in my
tí
life
kò gba ọmọ dúró.
that could not take up a
Ó
child,
ní ẹ lọ.
he said, go,
Ẹ lọ tú kẹ́tẹ́kẹ́tẹ́ yẹn wá.
go and release that coat.
Ó ní tí ẹnikẹ́ni bá bi ní wípé.
And if anyone challenge you and
Ó ní
say,
kẹ́ mú wá.
who asked you to release
Ó
it?
ní kẹ́ sọ fún wọn wípé.
Say, tell them
Olúwa ní fi
the
ṣe.
Lord wants to use
Ìwọ
it.
náà níbi tó dùbúlẹ̀ sí.
Where you're lying down or where you are,
Níbi tó dúró sí.
where you're standing,
Sọ fún Ọlọ́run.
tell the Lord,
Olúwa o.
oh Lord,
Ó ní mi fi ṣe ni.
you asked the need to use me.
Ó ní mi fi ṣe.
You had the need to use
Ló
me.
ṣe dá mi sáyé.
That is why you created
Ọlọ́run
me.
mi ò gbọ́dọ̀ yàgàn sí.
Lord, I must not be barren.
Ọlọ́run gbogbo ò gbọ́dọ̀ wọ́n mi.
All good things I must not lack.
Jésù Olúwa wa.
In Jesus' name, our Lord, we pray.
Jésù Olúwa wa.
In Jesus' name, our Lord, we
Jésù
pray.
Olúwa wa.
In Jesus' name, our
Ẹ
Lord, we
jẹ́ bá
pray.
mi wo Genesis 31:29. Genesis 31:29. Ó wà nípa mi.
láti ṣe yín ní ibi ṣùgbọ́n ọlọ́run bàbá yín ti sọ fún mi ní òru àná pé kíyèsí ara rẹ̀ kí ìwọ kí ó má ṣe bá Jákọ́bù sọ rere tàbí búburú.
Ibi tí wọ́n kà fún wa yẹn.
That place has been read now.
Bàbá ìyàwó Jákọ́bù ló sọ bẹ́ẹ̀ fún.
The father-in-law of Jacob said so to him.
Ó ní ó wà nípa mi láti ṣe ọ́
He
níbi.
said it's in his hands to hurt him.
Ó ní ṣùgbọ́n Ọlọ́run àwọn bàbá rẹ̀.
But the God of your father,
Mo fẹ́ kó o gbàdúrà o.
I want you to
Ó
pray.
ní àwọn ọ̀gá kan tó lágbára láti fi ìyà jẹ.
There are some powerful men that are ready to punish you.
Ó ní àwọn ìyá kan tó lágbára láti fi ìyà jẹ.
There are some others that are ready to punish you, to hurt you.
Ọ̀rọ̀ tí Bíbélì sọ ni wípé.
But the word the Bible is saying is,
Ó ní mo ní agbára láti ṣe ọ́ ní ibi.
he says it's in his hands to hurt
Ṣùgbọ́n
him.
Ọlọ́run àwọn bàbá rẹ̀ ni ò
But the
jẹ́.
God of your father says
Sọ fún
no.
Ọlọ́run o.
Say God,
Lónìí,
today,
gbogbo ẹni tó ní agbára tó náà fẹ́ fìyà jẹ
for
mí.
everyone that has the power to hurt me,
Gbogbo ẹni tó náà ní agbára òun máa pọ́n mi lójú.
he says he has the power to oppress and
Sọ
torment
fún
me.
Ọlọ́run lónìí.
Tell the Lord today,
Agbára tó ju agbára lọ.
the power that overpasses all
Ó ní
power,
agbára yẹn mi.
they should swallow up such power.
Pariwo rẹ̀.
Shout it.
Gbogbo ẹnikẹ́ni
Anyone
tó ní agbára,
that has power,
tó ní ipá,
that has power,
tó ní àṣẹ,
that has
tó ní
authority,
ìfẹ́ fi bá mi jà.
and he says he wants to hurt me
Nítorí pé èmi ń ru àpá
because I
Jésù.
bear the mark of
Nítorí
Christ.
pé mò ń ru àpá Jésù.
Because I bear the mark of Christ.
Lọ́jọ́ aláìlágbára.
Stand and render them powerless.
Àdúrà. Jésù Olúwa wa.
In Jesus' name I pray.
Jésù Olúwa wa.
In Jesus' name I pray.
Ẹ̀yin tẹ́ ṣe ń wojú Olúwa yẹn gbà dáadáa o.
You that you are looking for the fruit of the moon, pray this very well.
Nǹkan tí òbí ẹlòmíì ṣe
It's what our mothers has done
ni wọ́n
at
fi
the
ṣépè
past.
fún wípé
And they use it to curse that
gbogbo
person.
ọmọ tó bá ti
that every fruit coming out from her womb will never conceive. But a covenant supersedes another covenant. Today, I want you to tell the Lord that covenant working in our home, our family, that you will not go more than where you are supposed to be. Look at yourself very well. Some as prayerful as they are, when that covenant starts working, and we say, God, am I not praying? Tell the Lord, most.
If you are not careful,
but as you're walking in your family, that's the way you're going. That is the line we go. Where your father ended it, that is where you are stopping. But the Lord who has the covenant that is greater than all covenants, every covenant that is not saying good about me, every covenant not saying good about my work, every covenant against me, covenant that is greater than all covenants, begin to swallow them up in the name of Jesus. In Jesus' name, our Lord, we pray. In Jesus' name, our Lord, we pray. I want you to pray this prayer. Tell the Lord, all things you created under this earth, everything you have created under this heaven, command them. Let them arise for my help. Listen and hear the interpretation. Does bird fries? But when it's God's time, God commanded him, begin to give Elijah food. Yes. And when God was ready, and Joshua told the Lord that this sun must not set until he gives victory upon his enemies. And what if the sun had set, the enemy would have overcome. So I want you to lay fast on this. This new week I am entering. The Bible says, for my hands work, command me. Say this week, everything God has created, everything, Lord, you have created, Lord, give them authority to arise for my help. You look unto God, command everything the Lord has created, arise for my healing. You that your work is not moving well, everything you created today, and let them make way for me. In Jesus' name, my Lord, we pray.
Bàbá rere. Ó ní ọmọ á lè béèrè àkàrà kí bàbá rẹ̀ gbé ejò lé lọ́wọ́. Ọlọ́run á bẹ̀ ọ́ lónìí nínú ọlá rẹ̀, nínú ògo rẹ̀, nínú agbára rẹ̀, nínú àṣẹ rẹ̀. Òun la sọ wípé ohun gbogbo tó dá lọ́sẹ̀ yìí, Ọlọ́run kí wọ́n dìde fún ìrànlọ́wọ́ wa. Jésù, ọ̀rọ̀ kan ṣoṣo ni máa ń tẹnu mọ́. Wọ́n náà sọ wípé tí mo dẹ̀ mọ̀ pé ó sọ bẹ́ẹ̀ pé gbogbo ẹni tó bá ti wọ orí ilẹ̀ yìí, anything tí wọ́n bá ti béèrè, òun ṣe ni. Ó dẹ̀ kí òun yí májẹ̀mú rẹ padà. Wọ́n ní kì í ṣe ènìyàn tí yóò fi ṣèké. Tó bá jẹ́ bẹ́ẹ̀ gbogbo ẹni tó ń wojú Olúwa. Ẹ bẹ̀rẹ̀ fún àṣẹ tí a fi dá ìjọ yìí dúró lónìí. Ohun gbogbo tó jẹ́ kí àdúrà yín máa gbà. Ohun gbogbo tó ń gba omijé
omijé lójú yín lónìí apaláṣẹ nítorí ẹni tó ní ayé yín fẹ́ lò ó yá gbogbo ẹ̀mí bẹ́ẹ̀ jáde lórúkọ Jésù. Ohun tí Bíbélì sọ ni wípé àyà yóò pa àwọn àlejò wọ́n sá níbi kọ́lọ́fín wọn. Ohun tó sọ ni wípé ohun gbogbo tí Olúwa dá dáradára ni. Kí ni àìdá bá wọnú ayé yín nítorí orí ọ̀fẹ́ wákàtí yìí lórúkọ Jésù ká di ọlọ́mọ. Kó jẹ́ májẹ̀mú ni, kó jẹ́ ẹ̀ṣẹ̀ ni, kó jẹ́ ìwà ni. Jésù a bẹ̀ ọ́ nítorí ikú lórí igi àgbélébù, nítorí ọkọ̀ lẹ́gbẹ̀ẹ́, nítorí adé ẹ̀gún, ìwọ ló sọ wípé ó parí. Tó bá jẹ́ bẹ́ẹ̀ lónìí adarí àṣejédé yín jìyìn láti ìṣẹ́jú yìí lọ wọ́n pa àṣẹ pọ̀ mọ́ ti Jésù, wọ́n pa àṣẹ pọ̀ mọ́ àwọn wòlíì Ọlọ́run. Oorun tẹ́ ń sùn láti òní lọ ó yẹ kó já sí ayọ̀. Lọ́sẹ̀ yìí gbogbo ènìyàn ẹ lọ ṣe rere. Aláàánú tí kò nídìí kọ́mítì, aláàánú tí kò nídìí àwọn ènìyàn ó yá kẹ́ ẹ lọ wáyé. Ẹ ò ní wà bákan náà mọ́. Bó ṣe wù kó rí lórílẹ̀‐èdè yìí lórúkọ Jésù a ó rí tiwa ṣe. Ebi ò ní pa wá, ìyà ò ní jẹ wá. Májẹ̀mú ṣiṣẹ́ bí erin jẹ̀jẹ̀ ìlérí ó dópin. Lórílẹ̀‐èdè Nàìjíríà àlàáfíà yóò wọlé. Lórílẹ̀‐èdè Nàìjíríà ọkàn wa yóò balẹ̀. Ó ní ó sì ní ọdún tí èèyàn mú. Ó ní he harvest in thousands. No matter the famine in this land, no matter the famine in this land, no matter the famine in this land, we say it in the name of the name that is above all names. We will never lack. So shall it be. It is sealed, signed, and done. In Jesus' name we have prayed.
Ṣẹ nígbàlá tó mọ̀ pé Olúwa gba àwa ẹni àmúrò rẹ̀ là yóò gbọ́ wa látọ̀runmọ́ rẹ̀ wá nípa agbára ìgbàlà ọwọ́ ọ̀tún rẹ̀. Àwọn ìlú mọ̀kẹ́mọ́lé kẹ̀kẹ́, àwọn ìlú mìíràn gbẹ́kẹ̀mọ́lé ẹṣin, ṣùgbọ́n àwa rántí orúkọ Olúwa Ọlọ́run wa. Ní tiwọn ni wọ́n wólẹ̀ tí wọ́n sì ṣubú, ṣùgbọ́n àwa dìde àwa sì dúró ṣinṣin. Fi ìṣẹ́gun fún wa Olúwa, fi ìṣẹ́gun fún wa Olúwa, fi ìṣẹ́gun fún wa Olúwa. Pé ọba kó gbọ́ nígbà tá a bá ń kígbe pè é. Yẹ kí oore ọ̀fẹ́ Jésù Kristi Olúwa wa, ìfẹ́ mímọ́ ti Ọlọ́run àti ìdàpọ̀ ti ẹ̀mí mímọ́ kí ó máa bá gbogbo wa gbé láti sìn lọ àti títí láéláé.
Hallelujah! Hallelujah! Hallelujah!
pledge. I am a disciple of Christ, called to express charity to all and sundry, to display genuine humility in all my ways, because I am the righteousness of God in Christ Jesus, who must show integrity in my service to God and to all mankind, while remaining thankful in every situation.
Amen.
Amen.
Before the processional hymn,
Olúwa sọ wípé obìnrin kan wà láàrin wa lọ́jọ́ òní.
There's a woman I missed this morning.
Tí ó lérò pé òun lóyún ní ọ̀nà àìtọ́.
She's pregnant in a wrong way.
Ó sì ń fẹ́ lọ ṣẹ́ oyún náà.
And she wants to go for an abortion.
Olúwa kìlọ̀ wípé kí irú ẹni bẹ́ẹ̀ kó má ṣe ṣẹ́ oyún náà.
Wants for her not to abort such pregnancy.
Ààbò Ọlọ́run á dájú lórí wa o.
The protection of God will be sure.
Ìkejì.
The second one.
Olúwa ní láàrin àkókò yìí.
Within this period.
Sí àjọ̀dún ìkórè wa.
To our anniversary.
Olúwa ní ká máa bọ̀ wọn Ọlọ́run pàdé.
The Lord said we should meet with him.
Pẹ̀lú Isaiah orí ọgọ́ta.
Isaiah 60.
Isaiah chapter 60.
60.
Olúwa ní ká máa fi bẹ̀bẹ̀.
Lord, we should plead that she restore all what we've lost, and for the blessing of the Lord, all those things we think we've lost, the Lord promises He will return everything. The committee in charge of the programs, we are asked to inform you all the programs for this quarter, all have been recorded. If you are interested, see them at the multimedia units.
Orin àkọjáde KNS 485 Olúwa yóò pèsè.